Save the Mothers East Africa, in collaboration with Uganda Christian University, offers a Master of Public Health Leadership for multidisciplinary professionals trained to advocate for safe motherhood using their spheres of influence. Dr. Boaz Aruho, MPHL Class 2010, is an MPHL alumnus and proprietor of Mbale People's Hospital. Joining the MPHL program changed my mindset towards safe motherhood.
I said now I need to start a maternity home. And on People's Clinic, I added Mbale People's Clinic and maternity home. We started now opening to mothers. Started having antenatals, started delivering. And I did not mind whether you had money or not. Because it opened, people would come when they are already in labor and they don't have the money. And therefore when you tell them go to Mbale Regional Hospital because you don't have 20,000. Delivery by then we were charging 20,000, but they didn't have the 20,000.
Today the clinic has grown into a big private hospital offering mother-baby friendly services to the communities in Mbale. Using his MPHL research, Dr. Boaz also started a saving in a bottle intervention in rural communities in Mbale to promote saving at the household level to access maternal and child health services.
This project was that it was working with the church, that every Sunday mothers have to sit and they bring their savings in their bottle. So every mother would bring 700 shillings on a Sunday, we count, and then we give it to the treasurer, who also takes it to the diocese through the archdeaconry. Then we'll get all that money, take it to the main accountant of the diocese.
Sculpted from passion and perseverance. Its history will stun you and inspire you at the same time. He has made it his lifelong commitment to provide the best health care to mothers in the Elgon region.
Mothers who are pregnant and have tested positive, they come at Mbale People's Hospital for free antenatal care, delivery, and even those that will require operation, cesarean section. And we also opened up with our ambulance. It worked for us so much because within a month we started receiving mothers, we started receiving calls, and we were able also to take the mothers back home, try to counsel their families. It was like reintegrating the mother. These people face a lot of stigma.
Stella Agembi, MPHL Class 2012, is the Principal Nursing Officer, Tororo General Hospital, Eastern Uganda. When Stella completed her Master's in Public Health Leadership, the medical superintendent moved her to the maternity ward to save mothers and babies because she had been on the Save the Mothers program.
My MS said, you know what, you have been studying to save mothers, so please go and save mothers in the maternity unit. So I went to the maternity unit where I stayed for another 2 years, that is between 2015 and 2016. Those causes which make these mothers to die, they are preventable and they are known. And they are just few. You can even cram them. They are 5. If you see any bleeding, please, you run. Either PPH or APH. If you see any woman with hypertension, those hypertensive disorders in pregnancy can kill a woman. If you see anybody who comes with an abortion, please, that woman can die. Anyone with sepsis is a priority, and anybody who has an obstructed labor.
Her story with pregnant mothers is so touching, and just like Dr. Boaz, her inspiration came from the Save the Mothers Masters program.
We have what we call theater drugs. They are quite expensive. There is even something called anesthetic gas. There is a drug called halothane. You can't just get it anywhere. Even if you had the money, you can't go to the pharmacy in the town here and buy. Whenever we get a woman who cannot afford afford to buy these supplies, it is a big issue. People will call people in Kampala, call people at the district, call everywhere, and we are all bothered. And there are things you can't just go to the shop and buy. Why don't we concentrate on stocking those ones? So now even if we have a stock out, it won't be as bad as those days that you are completely at zero everything. At least you'll be able to find a glove somewhere, you'll be able to find some kavera somewhere as the mother goes to pick maybe drugs which you want to administer. When we lose mothers, it keeps on ringing a bell in your brain. And sometimes those mothers, we keep seeing them for some good time. If you didn't do something well, it lingers in your mind.